My name is Rachel Perrin. I live in Chicago, and I've been in Chicago, and also I kind of lived like a snowbird for many years going to Miami. I was a professional makeup artist before pain really stole from me. But what I'm going to tell you about is how I've been able to transform some of the things in my life, even through the worst of my pain, depression and PTSD. What I'm doing to overcome it in my life, agoraphobia, it's all there. For people who have a hard time getting out of the house because their pain has taken so much from them, I understand it. I've been there. And my father's a therapist. He's a minister. I work with people who do energy healing on a regular basis. My roommate studied in ashram in India. I should be able to jump out of anything, but you know what? There's sometimes that pain takes it all from you. And where do you go from there? So I'll start real quick. I fell down the stairs in 1997. I had shingles at the time when I fell. I fell on that shingles. I went down an entire flight of concrete stairs that flipped me over, and I was facing up the stairs when I landed. That is not a good position to land in, especially if you've hit your entire back on the way down. Everything hurts. They had to take me away on a backboard. They did x-rays. They didn't see anything broken. They sent me to work. This is not even a lie. I was a young woman, was 27 years old. I had been a personal trainer. I worked in nightclubs. I had a full-time job as a recruiter. And I was somebody who was active and not willing to give anything up. And so I thought, okay, I'm down a few days and I'm going to fight through this. And I did. I worked through it. And my pain still got worse and worse. I went into pain management. They got me on a ton of opiates. I should say opioids. Let's use the proper terminology. It helps us all in the long run. But I was seeing doctors who didn't understand what they were prescribing. And they were giving me so much Tylenol with Vicodin that when I saw a real pain treatment doctor at a university center, they were shocked that my liver was so normal. I don't know how I've managed to maintain liver function and some of the other function in my body, but most of it comes out pretty normal. I have been tested for MS. I did have chronic fatigue syndrome, as did my mother, my sister. We've all had shingles. I actually had a lot of problems as a child, and now they're finding out that what people thought were severe growing pains or juvenile rheumatoid arthritis, it's now juvenile fibromyalgia. It's things that happen to us along the way, and we do believe that at some point somebody hurt me when I was a child. Not going to go into it, but it ties into what we're learning about the trauma that we go through. I don't know that I had fibromyalgia as a child, but I had something going on. I was always sore, but I was an athlete too, so you never know. Moving on. I had my gallbladder out in 2003. When they intubated me, they jerked my neck and they popped a disc out. They extruded the disc. There's no actual proof that it happened. That was my first, other than the one little x-ray in the beginning, I would say that was my first major malpractice that I could have sued and did not. Through the years, it's gotten worse. I've had 3 spinal fusions now. Now, there are people who don't believe in having a spinal fusion. They think it might make it worse. Yes, they will collapse. There are all sorts of things that we can learn. You have to research everything. And there are so many Facebook support groups, virtual support groups, national associations like the National Fibromyalgia and Chronic Pain Association, the U.S. Pain Foundation. These people are advocates in the community, working hard like what Necie is doing here. They are out speaking to politicians. They are speaking to news outlets on behalf of all of us. And so we really do need to support them, whether we understand it all or not. The pain community has to come together and just agree to support each other and not fight the little pity battles. We have to be alternative healing, traditional healing, everything that we can. Just like we're talking about, healing is healing. Wherever you can get it, get it. Do as much natural as you can, because I will tell you, after my last spinal rebuild in 2011, that stole my career. I had been in Miami a month prior, working for a cosmopolitan photo shoot, doing makeup and hair, running on the beach, chasing after models. I got home to Chicago, the weather was cold and wet, and I did one photo shoot, I couldn't work again. I called my agents, and when I say agents, I had a top agency. When you're working for Cosmo, your work's being published all over the world, you're writing articles, you are an expert, and you have something to say, and people want to hear it. Now, I still do speak about beauty, but I've had to change my life because I can't carry a heavy makeup and hair kit. It's hundreds of pounds of junk, and you have to have it on wheels, drag it on a beach, drag it upstairs into lofts, and some of the time in the beginning, you're not getting paid very much. Although what Necie was talking about after that, the money is really there when you work hard and you achieve a certain level. And I lost that because I had to have my final fusion, which was a full rebuild due to broken hardware. I was told I had to take a full year off work and spend an entire year in a thoracic neck brace, which I did. I wanted to make sure that everything healed properly. But during that surgery, I don't know if I woke up during, but I was supposed to be in a medically induced coma that first night in ICU. I was not. I was in a delirium state where I thought I had been abducted, and I was struggling to get free, and they kept strapping me down tighter so that I wouldn't rip the tubes out of my neck. Now, there was no way that they could have known what was going on other than giving me more medication. And if you are a natural redhead or it runs in your family, there is a gene, and it's not just the redhead gene, but it's called, okay, sorry about that. There is a gene that a lot of people who have red hair or have red hair in their family, it's called the MC1R gene, and it means that you might need more pain relief. You might need more sedation. It also means that you might not come out of it as easily. And I've had this experience. My niece has juvenile rheumatoid arthritis as well. She's 16 now, but she's had 3 surgeries on her wrist, and she comes out screaming bloody murder. They can't give her anything to calm it down because there's so much going on and our bodies don't respond well. So when I finally weaned off of the heavy medication, I had PTSD. I had been off work for a full year, and I was ready to go in for my weaning. I got a call that my mother had multiple myeloma. I had to spend another year caring for her, sleeping in her hospital room, 70 nights, a lot of nights. I'll never get that sleep back again. I never thought I would have sleep before that, and now it's just all over the place. But what I want to tell you is when I finally got in for a wean, I'd been in for 2, I've been on 75 micrograms of fentanyl. I'm going to be very open about this because this is important for people to understand. I was on a 75 microgram fentanyl patch. It only goes up to 100 milligrams. That's because I have a pocket in my throat and I couldn't swallow extended release medication after my final surgery. They had also paralyzed my vocal cords for 3 months. I sounded like Minnie Mouse. That was fun. I would have been like this and you wouldn't have heard a thing today. I worked after 2 of those fusions, but this one got me. And I think it's because of the PTSD as well. When I chose the inpatient wean, it was amazing. Not only was I on 75 micrograms of fentanyl, I was on 116 milligrams of morphine, immediate release a day, to control my pain. It was that bad. And I was at Rush University. I saw top doctors. They got me down on a buprenorphine drip. They do this inpatient. It's not detox. It's not rehab. This is for people in pain who don't have addiction issues. They watch you carefully. It's nothing to be ashamed of. It's something to feel good about and feel empowered with. I left there, I had a psychiatrist visit me every day. I had my pain therapist from the pain clinic come in and do mindfulness meditation with me. These are amazing things. I have not fully been able to get back to work. It's impossible. I decided that I was so alone in my thoughts. My marriage ended right after my weaning. It just couldn't be sustained. We couldn't regain our intimacy. He wasn't willing to try. It was very difficult. And I've had a couple of years now to really digest. I went through training to be a pain advocate, and Necie's doing way better than I am at it. We all have our strengths, and she's got it down, and I'm so impressed. I went through this training. It was a 3-day weekend, and it was very difficult, but they understood that everybody there was in pain. So we had time, you know, if you wanted to go lay down on the floor and lay on a yoga mat, you could do it. It was great. And that's why these events are really important, to be around other people like yourself so that you don't feel alone. Because in our daily lives, we lose our friends because they get angry that we don't want to hang out. There's just so much loss, and the best thing that you can do is remind people, please don't forget to ask me. Please come over and visit me. Please come see me. I didn't have a lot of that, and my family is very close to me, and I started pushing them away because I was so angry at the world. And I don't ever want to be that person. I'm an extrovert, but I've turned into this closed-in introvert, and I've been working on agoraphobia daily. It's part of PTSD. If any of you have PTSD, bless your souls. It's a difficult road, but there is hope. There's a lot of it. The past 6 months, I have been weaning off almost all of my medication on my own. I'm still on a little bit of pain medication, but I have just changed. I've decided it was time to heal my body from the inside, and I'm working with a lot of the meditation, the yoga. I'm so interested in what all of you are doing, and everybody here. We all have so much to offer. In that time, I've actually gone back to school, same place that Necie has. I'm not finishing with them right now, but I started my health coaching program, and now I decided that I want to be a relationship coach. I want to go to school, and I want to help people who are losing their relationships and their intimacy and their connections. I want to work with people on those specific facets because that's what's healing me. Letting people back into my life, asking for the help that I need, and telling people I'm not okay today, and I'm alone, and I'm sad. And when somebody says, you just need to go out and go take a walk, I say, well, why don't you come and take a walk with me? Please take a walk with me. My legs work just fine. It's up here right now. And I need people to do that with me. And yes, inviting me to go do things. My friends are out in the nightclub still having fun. It's not the life for me. I need to find better experiences, find pleasure in life that's healthy pleasure. And so I'm designing programs to help people find the healthy pleasures in life. And I don't just mean sexual or intimate, I mean healthy pleasures, things that make you feel good about yourself. So I could go on for a very long time about things that have been said to me by doctors, family members. It's all destructive. You have to listen to the big voice in your head, not the little voices. And everything here today that you've heard has so much value. And if you take a few things from this and grow with it, I promise you, you will find major growth in your life. Look at all the alternative healing. They do suggest that yoga and mindfulness, as well as gluten-free diets, anti-inflammatory diets, they are the way to treat fibromyalgia outside of medication. So I do encourage you, if you haven't been tested for lupus, for Lyme, for all of the other overlying diseases, some of them are considered sister diseases. That's why a lot of the awareness is all on the same day every year. Make sure to be involved in Pain Awareness Month. That's September. Join some of the National Foundation's web pages if you're on Facebook or if you're on Twitter, anything you use. They're using social media so they can tell you when things are happening. They let you know when there's a legislative vote coming up that you need to know about. And trust me, When I tell you, just if you don't take opioid medication today, what if you have surgery or need to go to the ER for something and it's on your record that you're a chronic pain patient? Do you know what they do to chronic pain patients who go to the ER? They tell you you're a drug seeker and you can go home. This is a commonly heard thing. And I really encourage you to carry a list of your medications if you take them with you all the time. Have it in your phone. And if you do go to the ER, contact your doctor first. Let them know where you're going. See if they can arrange it for you. There's so much I could say to try and encourage people to be healthy and happy. I'm trying to be healthy and happy. It's a choice I make every morning to get up and just say, I'm here. I didn't die. I wasn't abducted. I'm alive. And I have a lot to offer still. And I have a lot to teach. And I want to teach it. And I want to make people happy and feel good about themselves.